All right. Good afternoon, everyone. My name is Sapna Tortal, and I'm the Managing Director of the University of California Center for Climate, Health, and Equity. I'm pleased to kick off two events that are happening right now, including the next webinar in our fall series for our center called Trainee Movements Bringing Climate Action to Medical Education, where our speakers will discuss their personal and professional experiences with building coalitions for climate action in medical education. This webinar also happens to be launching our fourth annual NorCal Symposium today and is the first of 5 exciting sessions looking at climate and health education. I want to thank the sponsors of the NorCal Symposium, which includes several departments in Stanford University in Medicine, UC Davis, and UCSF. And a special thanks to the UCSF Office of Sustainability for spearheading efforts this year, and the University of California Center for Climate, Health, and Equity for technical support, specifically Liza Hayes and Gail Lee. And finally, thanks especially to many of our students at these schools, including Alan Nudovo, Pedro Hernandez, Alania Kim, and Hussein Tagavi. It is now my pleasure to introduce the moderator of our first session, Dr. Ariane Tehrani. Dr. Tehrani is a professor of medicine and the founding co-director of the University of California Center for Climate, Health, and Equity. She's also the director for program evaluation and education and continuous quality improvement for the School of Medicine. Dr. Tehrani's research addresses education as a core solution to the climate change and health crisis. I'll turn it over to Ariane and our speakers now.
Thank you, Sapna, for the welcome and warm introduction. And thank you all for being here today. I am pleased to represent the University of California Center for Climate, Health, and Equity, which I've co-founded with Sherry Weiser, who you'll see later in the sessions today. Our center harnesses the health sector's expertise and leadership to advance equitable climate action. We really do believe that taking action on climate change is one of the most powerful health interventions of our time. And as a part of this, our center has been generating and uplifting climate solutions that focus on fostering healthy and equitable communities and a healthier planet for future generations. And this includes supporting climate action in the education realm, which is really the topic that we're going to focus on in this session and also throughout all the sessions today. I am very excited to be able to introduce both of our speakers today, who will be discussing their experiences in expanding medical education to include climate and change. And so with that in mind, our first speaker will be Harleen Marwa, a pediatric resident at the Children's Hospital of Philadelphia and a graduate of the George Washington University School of Medicine and Health Sciences. Dr. Marwa was the founding chair of the Medical Students for a Sustainable Future, a community of approximately 700 plus trainees across 120 medical schools working to combat the health harms of the climate crisis. She was the 2021 selected GRIST 50 Fixer and earned the 2020 Healthcare Without Harm Emerging Physician Leader Award in recognition of her work for Medical Students for a Sustainable Future. And our second speaker will be Carly Hampshire, a graduate of the UCSF School of Medicine, now an internal medicine intern at New York Presbyterian in Columbia, and a research fellow at the Health and Human Services Office of Climate Change and Health Equity. In 2019, along classmates and mentors at UCSF, she founded the Planetary Health Report Card, which is a student-led, metric-driven initiative that really helps evaluate and inspire planetary health education across the health profession schools. The initiative has grown to encompass over 100 medical, nursing, physical therapy, pharmacy schools in 13 countries. And in 2021, Carly took a gap year to focus on climate and health initiatives and worked closely with us at the UC Center for Climate, Health, and Equity. So before I turn it over to Dr. Marwa, who will be speaking first, I want to let you know that we will have a few minutes for the Q&A at the end. So please submit your questions to the Q&A feature. I will be keeping track of that, and I will share them with the speakers in a fashion that sort of helps bring things together. And so with that, Harleen, I'm going to turn it over to you.
Great. Thank you so much. Let me get started here. And it seems like you all can see those slides okay. So good afternoon, everyone. Thank you for attending today's symposium. And thank you for giving me an opportunity to share my story and a bit about my work. My name is Harleen Marwa. As was said, I'm in my final year of my pediatrics residency here in Philadelphia. And I was the founder of this wonderful community called Medical Students for a Sustainable Future. Today, I'm so excited to share with you the story of this group's start and illustrate how the lessons from this work can be applied more broadly to the climate and health movement. In sharing this story, I hope you're able to leave today with something applicable to your work. Maybe it's a framework for trainee engagement, maybe it's some inspiration for community building, and hopefully it's a feeling of hope for the work that you do. I thought I'd start today by sharing a little bit more about my own journey. I grew up in a region in Southern California with one of the lowest air quality ratings in the country. And while I didn't realize it growing up, my childhood was shaped by our changing environment, from poor air quality that prevented me from playing outside to increasing incidences of wildfires and more frequent droughts. I was learning how health is influenced by a multitude of factors and the importance of taking the full picture into account when prescribing solutions. To effectively promote health, I needed to consider influences like climate change, both inside and outside of traditional clinical settings. Later, through experiences in my health and work, I affirmed that climate change is one of the biggest health crises that our generation will face. And as many of you know and can relate to, the more you learn about this, the more you feel charged to advocate. I was fortunate to have some opportunities to amplify the health message when it comes to the climate crisis as a youth delegate to the United Nations climate negotiations, COP20 and COP21, where the Paris Agreement was signed. And it was at these meetings that I saw firsthand how clinicians and health professionals can be powerful advocates for their patients. I was inspired by those who amplified their patients' stories and elevated voices that were not traditionally represented at these decision-making tables. Ultimately, I was inspired to go to medical school. Now, as a pediatric trainee, I can see clearly how my work in climate advocacy aligns with my role as a pediatrician. In both roles, I'm tasked with looking ahead, collaborating across disciplines, and empowering the rising generation. In medicine, we have the privilege to walk through tough moments with our patients. For me, this means I often see the world through the eyes of the children I care for. And in doing so, I cannot ignore how the environment influences their health. So climate change is undoubtedly a huge problem. It can feel like an uphill battle, and it can become easy to doubt the work and the impact of our work individually. Collectively, however, we know we are stronger. We see this every day in our work in medicine. Our toughest cases are tackled through teamwork. And it was from this framework of collaboration that Medical Students for a Sustainable Future was born. In 2019, we launched Medical Students for a Sustainable Future, or MS4SF, to be a community of medical students uniting to take action on climate for health and for our future patients. Prior to MS4SF, there was no collective medical student-driven voice on climate change and health. Our members engage in this work in meaningful and innovative ways. At any given point, the community is tackling numerous projects across a breadth of work streams, including advocacy, curriculum, research, climate-smart healthcare, partnerships, communication. We also amplify the work of the Planetary Health Report Card, who you're going to hear from after this talk. Our members are engaging and collaborating on climate and health in creative and in important ways, from launching podcast series to leading meetings with congressional representatives to hosting national journal clubs on the latest evidence regarding health and climate. In having this variety of work streams, we can see the many ways we can get involved, create solutions, and be change makers. And while much of MS4SF's work is conducted virtually, we've been able to cultivate this strong sense of community within our group through our meaningful and purpose-driven work. And the group's continued growth and impact illustrate not only the passion and drive of these medical students, but it also indicates that climate change is top of mind for future clinicians. Medical Students for a Sustainable Future came together in the summer of 2019 through grassroots outreach and support from partners. From 6 students, word began to spread. Soon we were 10, then we were 20, and in the first 5 years, our organization has grown to a community of nearly 700 medical students in over 100 medical schools around the world. As I mentioned before, the exponential growth of this community reflects a deep understanding that climate change is a critical obstacle to the health of our patients, and trainees are inspired to catalyze action now. We cannot wait. Students get involved in MS4SF in a variety of ways. They can get involved as individual members, or they can establish an MS4SF chapter or an affiliate interest group at their school. Recently, MS4SF chapters were surveyed on what their chapter was most proud of. Some talked about their curriculum efforts in the Planetary Health Report Card. Others shared more about composting programs they had started or other waste reduction efforts. Some talked about events they were organizing, including movie screenings or guest lecturers. One even discussed integrating sustainability leadership as a permanent position on the school governing council. These are just some examples of the creative and meaningful ways that trainees are inspiring change. And while we have a breadth of work streams in a variety of ways that members can engage, we also recognize that training is a busy time, and we employ the spectrum of involvement model to support participation during the ebbs and flows of medical training. Using this framework, we create space for members to join work in a flexible and sustainable way. Along the x-axis, you'll see time commitment, and along the y-axis, you'll see energy commitment or activation energy. So for members who are in a busy time, we offer discrete one-time learning opportunities. For members who might have a little more bandwidth, we offer medium commitment projects. And for members who have time and lots of passion and capacity, we offer leadership roles and a variety of opportunities they can engage in. So for example, learners might want to attend a lecture, listen to a podcast, read an article, something that's a short time period and that they can schedule around something that works for them. Engagers may have a little more capacity to author an editorial or participate in a journal club. And then organizers might have an interest in taking on a leadership role or designing a research study. In having this evolving scope of how members can get involved, it keeps trainees connected to the work in a meaningful and sustainable way during all the busy seasons of clinical training. One example that demonstrates these frameworks well is the MS4SF Guide to Climate and Health Curriculum Reform. This was initially created by our 2021 chairs, Natasha Sood and Sarah Shu. This guide continues to be updated and is relied on by students around the world. Inside the guide, you'll find proposals, sample syllabi, lesson examples, environmental justice resources, and more, so that students can learn best practices from each other on how to incorporate climate and health curricula into their education. Members may choose to read the guide, create a proposal for their own institution, or join the curriculum committee based on their own interests, their time, and their bandwidth. Regardless of how they engage, they have the full support of the MS4SF community and the benefit of collaboration, as you can see in the example shown here. Through our virtual channels, members communicate with each other, seek feedback on proposals in real time, and share latest resources with each other. By working in community, MS4SF cultivates a collective voice of changemakers. This voice has garnered the attention of media outlets like the Huffington Post and more. The collective voice has also been featured in numerous academic journals. MS4SF has also established itself as a leading voice in this space, being invited to the table for important conversations like briefings with EPA administrator and other government meetings, as well as international meetings and professional society discussions. In having a growing community, members can rely on this network to continue to amplify and grow their projects. You'll hear next from Dr. Hampshire about her inspirational work launching the Planetary Health Report Card and Dr. Natasha Sood's work building the climate resources for health education. The MS4SF community is always excited to support and help scale the innovative work of our members. And the support doesn't stop after you graduate medical school. Our alumni members go on to lead climate and health work within their disciplines, from speaking at national and international meetings to launching specialty-specific GME and CME programs. The MS4SF community is a launching pad for work as a lifelong advocate and climate and health leader. I often think back to my own childhood, remembering those days of poor air quality and wildfires. Today, we see kids demanding action and leading movements for change. As a leader in this community, I have experienced the collective urgency from trainees to address this issue. We recognize the power of our voices and use it to advocate for our communities. We know that climate change is both a leading threat to global health and an opportunity to reimagine a healthier, more equitable, and more sustainable future. As we said in our original MS4SF launch on Earth Day 2020, on the other side of crisis, there is opportunity, there is resilience, there is hope. And I always like to say hope is my favorite renewable resource. That being said, I encourage you all to identify what sparks hope in you. For me, it's the trust from my patients, the brightness of young people like my niece featured here, and the unbounded inspiration that comes from working in community with groups like MS4SF. Thank you so much.
Thanks, Carlene, for those inspiring comments as always. I'll go ahead and share my screen next. Right. Well, it's great to be here with you all. And thanks to the UC Center for Climate Health and Equity and the organizers of the NorCal Symposium for inviting us. As Ariane mentioned, my name is Carly. I'm an internal medicine intern at Columbia now, but recently graduated from UCSF. It's so nice to be back with my West Coast people, and I'm wearing my Birkenstocks under my desk for solidarity. And I'm excited to talk with you today about a couple of different interconnected trainee movements on climate change and health that partially grew out of MS4SF and the path that Carlene laid. So one is the Planetary Health Report Card Initiative, an initiative that I founded back in 2019 and has grown with the support of many people in the audience here, and two, the Climate Resources for Health Education Initiative. And one thing we know about communicating climate change and health, and really about communicating anything at all, is that numbers numb, but stories stick. So I'm going to tell you about the motivation for the report card as a story. And the photo on the backdrop of the slide is what the sky looked like when I started medical school in the fall of 2018 as the campfire was raging across Northern California. And maybe some of you remember the days surrounding this fire or the dozens of similar ones as wildfires have become more frequent and more severe thanks to climate change. Yet even though we were walking to school every day in N95 masks, breathing in some of the worst quality air in the world, and hospital admissions for respiratory illness were spiking all across the city, our medical school lecturers really did not acknowledge the health effects of air pollution or wildfire smoke in our curriculum, which was especially notable given that we were in our respiratory block at the time, living and breathing respiratory illness. So it felt like there was this large gap between what was going on in the outside world, this real life manifestation of climate change being the greatest threat to health in the 21st century, a quote that comes up often, and what we're learning inside the classroom. And I soon found out that other students were as disillusioned as I was with the lack of climate change in medical school curriculum. In a student survey of about 600 medical students across the country that we led, 84% believed that climate health was needed in the core curriculum, but only 13% believed that their medical school was providing adequate education. And perhaps most striking was that only 6% of surveyed students felt very prepared to discuss climate change and health with the patient. And this lack of confidence in communicating climate change and health is a problem because we know, based on research led by Ed Maybach and others, that health professionals are some of the most trusted sources for climate health information, more than even public health agencies and climate scientists, especially when you look at the conservative side of the political spectrum. So patients want us to have this information, but by and large, health professional students are just not trained to understand, manage, or mitigate the health consequences of climate change. So in today's brief talk, I'm going to talk about three things. One, briefly just to lay some groundwork because this is the first session of the day, first session of the North Cal Symposium. Beyond wildfires and air pollution, how does climate change affect health? And how does the healthcare sector contribute to global carbon pollution? Then I'm going to talk about a couple student-led initiatives to try to address the gap between where medical education needs to be and where it is now. And then lastly, I'm going to talk about some opportunities for you to get involved in this exciting movement. So this image summarizes how global warming leads to climate-sensitive health risks via a number of different exposure pathways moderated by various patient and health system vulnerability factors. So if we take the example of heat, we know that climate change makes heat waves more frequent and severe, and that heat exposure leads to increased rates of kidney disease, cardiovascular disease, and mental health impacts, including increased rates of violence and suicide. But if someone is, say, an agricultural worker and doesn't get the day off from working outdoors, or if someone can't afford to turn on the air conditioning, of course, they're more sensitive to these health risks. And say the emergency department is overcrowded because there aren't cooling centers that people can be diverted to. All of those things will increase someone's risk of climate-related disease. But the good news is that we have an opportunity to work on each of those bulleted lines in the diagram in order to mitigate health risks of climate change and protect our communities. And yet, though climate change clearly affects health, ironically, healthcare delivery exacerbates climate change. So as many of you are probably aware, the US healthcare sector is responsible for 8.5% of national greenhouse gas emissions. So us in healthcare really need to clean up our own backyard, especially given the moral imperative we have in medicine to do no harm. So that was a little bit of framing, but the bulk of the presentation today will be about the Planetary Health Report Card, which is a student-led metric-based initiative to increase planetary health engagement in health professional schools. And the report card really catalyzes student-led, faculty-mentored teams to conduct a planetary health needs assessment at their medical schools and evaluate their institution on various metrics that we outline. And the idea is that then students can work with faculty and administrators to address the gaps they identify, gaining inspiration from efforts that are going on at other schools through our report card repository, idea sharing events like institutional advocacy workshop and symposium, and our active online community via Slack, similar to the post that Carlene shared. And coming back to this slide, put another way, our goal with the initiative is really capacity building for our healthcare workers, that red box outlined there. So in a changing climate, our healthcare professionals need to be able to diagnose the health problems associated with climate change and how to manage and treat those impacts. And as students and trainees, we depend on our institutions to provide that training part. So the Planetary Health Report Card is an attempt to translate the very abstract nature of those challenges to very concrete metrics and competencies. What does it actually look like on the ground to have a planetary health education? And the report card is divided into 5 different sections with some examples of metrics shown here. In the curriculum section, we ask questions about what material the formal curriculum covers. In the research section, we ask about planetary health research opportunities and opportunities to share and learn about that research. In the community outreach and advocacy section, we ask about community partnerships and community-facing educational initiatives. In the support for student-led initiative section, we ask about student representation and informal student programs for things like a sustainability QI project. And lastly, we have a number of metrics looking at campus sustainability, though we don't really assess hospital sustainability, given that we felt there were other good resources through Healthcare Without Harm and Practice Green Health for that. And these metrics were drafted with the help of over a dozen experts around the world, as well as a review of previously published competencies. And we've iteratively been redefining the metrics over time, especially as we've expanded into different countries and have to think about international generalizability. And just to give you an inside look into what this looks like from the student side, this is a screenshot from our template. So for each metric, students will select a point tier and write out an explanation of why that point tier was selected with links to associated resources whenever applicable. So the idea is that then the report card can serve not just as a scoring tool, but also a comprehensive resource for those interested in exploring the institution's planetary health offerings. And then in that red section, we also provide exemplars of what other schools are doing so that students can get ideas for initiatives that they might want to pilot at their own schools, as well as have discrete examples to refer to if their administration comes back and says, well, that's just unrealistic, that we can't do that. You can say, well, this other school's doing it. And we've also partnered with the Climate Resources for Health Education Initiative, which is a trainee-led multi-institution collaboration from the Global Consortium on Climate and Health Education, Brigham, MGH, Emory, UCSF, Stanford, and UW, founded by Natasha Sood and currently directed by UCSF medical students Alan Adobu and Terrence Sirius. And Climate Resources for Health Education creates an open access repository of expert-reviewed climate health learning objectives, lecture slides, and cases that are created by trainee and faculty teams that launched last year. And we've mapped all of the resources available through CRHE to the report card metrics such that there's this really powerful 1-2 punch of problem and solution. You find the gap and then you can address the gap. And here's a picture of what that mapping looks like. So say you're a medical student who just evaluated your school's curriculum using the report card and you realize that there was nothing on the health risks of extreme heat. Rather than having to work with your institution to create that curriculum de novo, which is a whole lot of work, you can adapt one or more of the 6 different expert reviewed clinical cases that already exist on extreme heat that CRHE has available open access, freely downloadable. And in terms of actually participating in the report card, the annual cycle occurs along the academic year, and all of the school teams follow the same timeline as one large community. So in August and September, our regional leads recruit schools in their region, help students at those schools build a team. In October, we host a mandatory orientation that describes the implementation process and allows students to meet all of the hundreds of students that are completing the report card alongside them. From November to February, student-led teams with faculty mentorship complete the metrics, eliciting input from administration, faculty, and staff. From February to March, our leadership team reviews the report cards and recommends edits necessary. And then finally, on Earth Day, we release an annual report that summarizes all the school scores and highlights examples of innovative ways that schools have met the metrics to hopefully inspire cross-pollination of ideas. And here's a picture of the medicine report card from this year, both the cover page as well as an example from one of the country-specific rating tables. And most schools tend to score in the B or C range, which is kind of what we're going for. It highlights the room for improvement that very much exists at every school, but also doesn't fail everybody such that they don't even want to participate. And when we started this initiative in 2019 as a pilot at UCSF and Stanford, we didn't really know how it would go, if there would be student interest, but the initiative quickly grew to include 13 medical schools in 2020, to 62 medical schools in 2021, to 74 medical schools in 2022. And for this last year cycle, the report card was translated into German, French, and Japanese. We had teams at 96 medical schools in 12 countries, plus report cards for nursing, pharmacy, and physical therapy led by students and faculty in those disciplines. And for this upcoming cycle, we have teams at 160 medical schools, as well as plans in the works to establish report cards for residency programs, as well as dentistry and veterinary medicine. I think the interprofessional expansion of the report card is what I'm most excited about because we recognize that healthcare is a team sport and this need for planetary health education really cuts across all health disciplines. And here's a map of the 2023 participating institutions from all over the world. And though most of the organizing work is over Zoom with a fair bit of time zone Tetris, it's always a treat to get to meet people in person. And actually, when I was at COP in Egypt last year, I randomly met 2 report card student leads from Australia and Switzerland. So I had to throw in a picture of that because it was just such a cool moment for me. And the impact of the initiative has been highlighted in international media. So here are some of the articles that have been published. And various teams all over the world have also written about their experience with the report card and curriculum implementation in various academic journals. So you can see from Germany, from Canada, from Ireland, and from here in the US. But of course, what we're really interested in is how the report card has helped catalyze real change, since that's the goal. That's what this trainee movement is working towards. And we collect data from our teams as to how being part of the report card has led to changes at their institutions. Here at UCSF, the report card helped establish a needs assessment that led to a grant for the longitudinal integration of climate health and preclinical curricula. And other schools have developed planetary health task forces or boards. Some have launched student groups, environmental electives, or office of sustainability. And many have had lasting permanent changes made to their curricula, including some exciting curricular threads. And on the curricular threads note, I wanted to highlight an image from one recent publication, which outlines how the report card catalyzed a whole series of changes at Brown Medical School in the US. And in their paper that they write, the key event that led to the consolidation of student efforts with the backing of the medical school administration was the 2020 Planetary Health Report Card. And from there in this timeline, we see the formation of the Planetary Health Task Force, which launched mandatory waste training for all clinical students, various community partnerships, a pre-clerkship elective, and more. And super excitingly, they're working on establishing a scholarly concentration in planetary health, which would be a pathway for students to engage longitudinally in planetary health across all 4 years of medical school. And I know some other programs that have established similar pathways will be speaking later, so more to come. And a lot of what we try and do with the report card is crowdsource information on what are the barriers that you're encountering with integrating this content, and what are the best practices that you've found for overcoming these barriers. How can we learn from each other's experiences to accelerate this movement? So with that goal in mind, we'll share some of what we've learned. First, barriers. A lot of the barriers are related to lack of resources, lack of faculty expertise, lack of funding, lack of curricular space. And from the student side, there's also this sense of, I already have to learn so much to become a health professional. There's already this fire hose of information coming at me. How can I add this to when it's not even tested on my licensing exams? And so some of the best practices we found for addressing these barriers are, one, integrating climate and health into existing curricula rather than inventing it de novo. So where you're already learning about vector-borne diseases in the infectious disease block, can you throw in a slide or two about the changing geographic distribution of those vectors due to climate change? Or where you're already having a lecture on structural determinants of health, can you use shade equity and heat as an example? So this curricula doesn't really require brand new standalone lectures. And in fact, it's more effective if the curricula is integrated, because it's not as existentially overwhelming for students, and it's also better reflective of just the broad, pervasive health consequences of climate change in really any organ block you can think of. Two, faculty and student co-production of knowledge is very helpful. So students can bring energy, a valuable student perspective, and faculty can bring clinical knowledge and longevity, ensuring that resulting curricular transformation is sustainable. It doesn't just go away the next year. At UCSF, there's been tremendous faculty support, including Ariane, Catherine Gundling, and Heather Whelan. And we've been really lucky to have them. And another facilitator is thinking about how institutions can crowdsource curricular materials when possible through initiatives like CRHE. The title of this session is Trainee Movements and Climate Change and Health, and the benefit of movements is that they're collaborative. So how can we learn from each other? And lastly, getting top-down support within the institution from people like the curriculum dean, and getting funding for a full-time staff member responsible for integrating the content. And also larger scale top-down support, getting content included in licensing exams and formal accreditation requirements at a national level. So how can you get involved in this movement? If you're interested in joining or starting a report card at your institution, it's not too late for this year. You can reach out to phreportcard@gmail.com. And just to give a pitch, one of the reasons I think the initiative has been so successful is that completing this report card is a very tangible project and accessible entry point into this work, and subsequently breeds a whole lot of tremendous community ideas and momentum. And then another very tangible opportunity is contributing to the Climate Resources for Health Education Resource Bank that I highlighted earlier. So if you're a faculty member, you can sign up as a reviewer or advisor. And if you're a trainee, you can sign up to build a case or slide set in a team with a lot of guidance. And more broadly, I would just say to find your community wherever you are. as many of you know firsthand, working in the climate and health space can be really demoralizing sometimes. And sustainability is necessary in all of its various forms. So community is what makes the work sustainable and full of joy. And here are some pictures of my beloved climate and health trainee community just from my last few months in New York, whether it's at conferences, up here, the Climate and Health Conference, highly recommend, rallies, or filming simulations of climate health education and action. And I know that was a whirlwind tour of these initiatives, but I'll stop there. Look forward to answering your questions. And I started this talk with a picture of what the sky looked like when I started medical school in San Francisco. And just to come full circle, this is actually what the sky looked like when I started residency in New York City this summer. So plenty of work to be done, but hopefully we can join forces and continue to make strides together in rolling out the next generation of climate and health education.
Thank you both very much. And I'm saddened to see that last picture, Carly. I am sorry that that's how medical school and residency kind of came together all around wildfires. I want to just take a moment to acknowledge the incredible amount of work that you've both described you have put into this, and really have discussed the incredible impact. And before we go into the Q&A, there is, well, I mean, I'm deeply impressed by your work, your strategy, your thoughtfulness, and the momentum you've created. And I also want to pay important homage to the important role of student activism throughout the course of history, particularly if we look at, like, for example, schools of medicine or the health profession schools. Student activism has been an incredibly powerful force towards social change. And in medicine, student activism has included things like, students speaking up around mistreatment issues of students, advocating for decolonization, holding the medical profession accountable and institutions accountable for their work. And it's really been an effective method. We know this through a lot of the research around this area, that student activism has educated, it has raised awareness, it has opened new ways of thinking, and it's really enabled students and faculty and staff and just society in general to confront and solve problems that are facing us. And so I would like to sort of jumpstart from that point and ask you both, and you've both talked about this, but I want to distill out this message. As institutions, as groups that want to facilitate this change, we want to be able to support students in these movements. And if you were to just reflect on the top 3 things that helped you move this work forward, what would those 3 be? And put it out to all of us who are here in a way that is prescriptive. What can we do?
I can go first, and then Harley, and definitely looking forward to hearing your comments as well. I think what was really helpful in making the Planetary Health Report Card a feasible reality was that all of the administrators here never said no right away. They had questions, but they were curious, and they approached it with a lens of, we want to help make this possible and make it better, not we want to squash it. And I can totally imagine in the early stages were that support not there from the administration, it never even coming to existence to begin with, because I think as a trainee, you're balancing wanting to transform your institution and the movement in ways that match what the world needs, but you also don't want to ruin your own career in the process. And so if there had been a tension between the administration saying, no, you can't do this, I think it would have been really hard to make it a reality. So I think to summarize that, just approaching student projects with a lens of curiosity and wanting to make them better, not trying to put them down.
Yeah, I completely agree and echo Carly's answer. And I appreciate that you raised that point. I think in the early days of thinking about medical students for a sustainable future, what we wanted this organization's mission, values, and goals to be, we spent a lot of time actually meeting with other medical student activists in other disciplines. So not just working on the climate crisis, but those who had done a lot of work towards health equity, and like racial injustices. We've met with a lot of them to ask, what are the best practices that you've learned from launching these movements and how can we implement that here? So we're always incredibly appreciative for the groundwork that was laid by a lot of those before us. I completely agree with Carly's answer. And I think that yes and mentality from leadership is really empowering to students and trainees and allows them to think about their work critically while also getting support. And so even if there's certain hesitations about their work, giving them a yes and let's think about this, here's some resources for how to think through it. I think that's incredibly helpful. The other two pieces that I'll kind of add to this are, I think, inviting trainees and students to have a seat at the table is so important. Inviting them into those meetings, letting them see, what goes on in the process of designing a curriculum, what goes on into the process of designing a university policy, wherever you're able to invite trainees to have a seat at the table. I think that can be really empowering for students to know what's going on behind the scenes. How are these decisions made, and where are there levers and opportunities to make a difference? Similarly from that, I think that introducing them to partners or having some key partnerships for these student movements can be really effective from a time standpoint, from a resource standpoint, and ultimately I think it boosts credibility if you're able to partner with organizations who've been successful in this work before. And so I think partners, seats at the table, and that yes and mentality are three really tangible things that institutions can do to support trainee-led movements.
Totally agree, Harleen. And one last point, just since I imagine there are some administrators with some purse strings on the call, like funding is so important. So much of this work in this space is volunteer-led, completely unpaid, and so many people pour hours and hours of their time fully out of passion and belief that this is the most important problem of our generation. But there needs to be funding as well, especially when it comes to curricular integration, because building curricula is a whole lot of work.
Thank you both. That's very eye-opening. There's a couple of questions on the Q&A. So one question is, have any school districts adapted the Planetary Health Report Card to evaluate their own curricula and admissions? I mean, that's a really intriguing question. Has that ever come up?
It is a very intriguing question. And I think our approach with the report card thus far has just been sort of welcoming any collaborations and adaptation ideas that people have. So a lot of the interprofessional report cards that have been developed is because we get an email from somebody in, like, for example, a physical therapy discipline, and they say, hey, I would like to create a physical therapy report card. And we say, sure, like, let's have a call. We'll try and give you some tools to help make that happen. But really like rely on leaders in those disciplines to adapt the report card. And so in terms of adapting the report card to evaluate school district curricula and admissions, we would welcome that. It's just a matter of getting a leader in the school district who is excited about that idea and has the expertise to do an adaptation at the table.
Thank you. The other question we have is, what were the mechanisms, what were the steps that you used to reach students within and outside, or trainees within and outside the United States? So it sounds like you have both created a lot of momentum, just here and also just throughout the world. And if you were to reflect back on how you navigated that outreach, how you reached other trainees, I think folks would like to hear more about that.
I have to say, when we started the report card, we didn't really envision that it would be so international. It started off with just 13 schools in the US and one in Canada. And what generated the international expansion was first someone from the UK reaching out to us and saying, hey, I was looking into doing a research project on evaluating the curricula for schools in the UK and noticed this report card. Like, I don't want to reinvent the wheel. Can we just use the report card? And we got on a call, and that person was Hannah Chase. She became the co-director for the report card because I very quickly recognized that she was just a force, and she recruited every single medical school in the UK to participate. But in terms of international expansion from there, it's been a lot of people coming to us. We don't necessarily seek out partnerships in other countries, but I think Twitter has been really helpful. It's a little bit sad that Twitter is now in a doom spiral because I think a lot of this trainee movement has been built on Twitter. And then just presenting at different conferences that are international, and COVID kind of helped facilitate that in some ways, because conferences that would have been inaccessible to trainees, inaccessible internationally previously, now they were on Zoom. And so anyone from anywhere in the world could join and hear about what was going on and try and apply it in their setting.
Yeah, I agree that the conferences have been incredibly helpful. I think a lot of medical students for a sustainable future in the early days was, like I had mentioned before, kind of those key partnerships with other organizations who were leading the charge in climate and health. And so organizations we spoke with included Healthcare Without Harm, the Medical Society Consortium on Climate and Health, Physicians for Social Responsibility, really going to those organizations and asking them at those beginning days, do you all work with any medical students? Do you work with faculty who work with medical students who might be interested in spending more time working on climate and health? And that's really how we got kind of the initial 6 students on that first call to brainstorm what we wanted to do. We were just so excited to have found each other. A lot of us felt like the only climate and health person in their medical school class. And I think similar to what Carly said, we didn't expect this exponential growth. But I think it really underscores how much trainees are thinking about the climate crisis and how urgent it is and how much they can't wait and they want to take action now. And so we were excited to see that continued growth through word of mouth, through partner organizations. We've done some more strategic campaigns, emailing out to, faculty at medical schools working on this topic. Our Earth Day video that we did with our initial launch was also to make people aware of who we were. And then I agree, right now, it's a lot of, putting our name out there at conferences, getting medical students to set up MS4SF chapters or affiliate organizations, and then continuing to, spread this community through those channels.
Fantastic, thank you. And related to that, one other question is, both of you have spoken quite eloquently about your presence in national and global meetings, including the high-level UN negotiations. And the question is about really, how have you brought in the voice of trainees into those negotiations? How have you, or those meetings and places in which you've been present, how have you made sure that those voices are up front and center?
Yeah, thanks so much for this question. I think one of the things that we get really excited about is amplifying the voices of the trainees and thinking really really deeply about the unique niche that the trainee voice fills. And so for us, it's really thinking about, we're caring for patients currently, but we're also thinking about all of the future patients we have yet to care for, and what are the challenges that they're going to be facing, and how can we prepare ourselves. So when I think about how we amplify those voices and bring them to the table, there's a couple of different ways. I think one, at these meetings, a lot of it is collaborating with other trainees and students on the ground, figuring out if there's some sort of speaking engagement or some sort of event that we can co-host together while we're there, whether it's to build community or to raise awareness for what current trainees are thinking about. Carly already touched on this, but social media can be a really powerful way of amplifying that voice. So even just getting it out on social media to let them know trainees are here, we're thinking about this, and here's the reasons why. And then, one of my favorite things to do, both during medical school and residency, has been collaborating with other trainees on written pieces that either go in the lay media or in academic journals. It's been really fun to reflect on this work and what drives us and fills us with passion, and be able to get those messages out there. And so I think there's a lot of both in the moment, how can we bring the trainee voice to the table? But then there's a lot of work that can be done surrounding the meetings through written pieces and social media.
Yeah, I totally agree. I think globally there's a recognition of the importance of youth voices in the climate and health movement and the climate movement at large. And so if anything, attending these conferences and national meetings, I feel like they are really interested in hearing about trainee voices and definitely are giving us a seat at the table, and agree with Harleen that one of the most fulfilling parts is meeting people from all over the world who are doing this work. And even if you've never met before, right away, you gravitate towards each other and start getting ideas flowing about ways that you can cross-pollinate. And I still follow like trainees from all over the world that I met at COP on Instagram. And so I see not only like their professional lives, but also their personal lives. And I feel like we've become true friends despite only meeting in person maybe once or twice.
That is the way of the world these days. So I hear you on that. We do have quite a few questions that are coming in. I'm going to try to prioritize. I think there is one question about connecting directly with other student affiliates who have been doing other kinds of work, like, for example, the International Physicians for the Prevention of Nuclear War, or the National Health Program. Do either of you collaborate across similar student groups that are working on activism type of issues?
Yeah, I think there's a lot of cross-pollination of ideas among the various student groups because climate justice and climate change and health is so intersectional. And I think people recognize that. And so actually the Planetary Health Report Card was born out of the Racial Justice Report Card, which is a project of White Coats for Black Lives. And we kind of sat down with their leadership and we're like, what made this tool so successful? How would you feel about us adapting something similar for planetary health, recognizing that there is a lot of overlap between institutions wanting to implement the work, but not always knowing how to do it because it can be kind of abstract. So translating abstract concepts like racial justice and planetary health into what does it look like on the ground? What are the tangible metrics? And then in terms of the other like groups that we've collaborated with, definitely a lot of groups have reached out to us trying to, like, for example, national medical student organizations, if they have a committee on planetary health or climate change, how can they introduce the work of MS4SF or the Planetary Health Report Card into those committees, or leverage their wider networks to amplify the curriculum guide or the report card when it becomes published annually.
So we have 5 more minutes, and I think we're probably going to have time for 1 or 2 more questions. There is a question specifically about nursing programs on Planetary Health Report Card and CRHE, but I think that is something that I'm going to suggest that Carly, you and I will connect the speaker with you. But there is one question that I think would be important to have both of you speak to. It's, have there been institutions who have fully resisted adding climate into the curriculum? And let's actually broaden that a bit. Fully resisted any of the work that you're doing, period. It doesn't have to be about curriculum. It could be about any of it. And if you were to reflect back, really, how long between initial engagement and real change, be it curriculum or otherwise, did you feel was the norm? So let's start with the first part of it first. Were there resistance points, and where were those?
There have been a few institutions that refuse to let their students do the report card altogether. I think we thought it would be more of an issue than it actually has turned out to be. It's been by far the minority. And I think that as those institutions have realized, oh, wait, this is a movement. There are so many medical schools across the country that are doing this. Maybe we need to back off a little bit. Their thinking about it has changed. But certainly there has been some resistance. I think nobody likes to be graded, institutions included, and especially when an institution kind of can anticipate in advance that we might not score very well, they don't want that out in the world. And it puts students in a really hard position, because then with their careers on the line, they feel like, okay, even though I did all this work already, maybe to fill out the report card, I have to dial back. And then to the second part, if you want me to speak briefly to that, actually, I'll let Harleen go.
I agree with Carly completely. I think there's definitely been institutions that have been less warm to the idea of talking about this topic. And I think we've seen an uptick in that in some parts of the country when a lot of science has become politicized, and MS4SF and the Planetary Health Report Card launched in the middle of a political season as well. And so I think that added a lot of complications to our work. I think that what I found has been really helpful for those students who are looking to engage in this work and might not be receiving support from their institutions is that's when coming to global movements like these can be really helpful for those students to channel that energy and still have an outlet to engage in this work. And I think similar to what Carly was saying, the once the momentum is there, it becomes harder and harder for individual institutions to say no. And so I think, while it can be really hard to be the first one to do something, it's also no one wants to be the last one to do something either. And so I think once that momentum picks up, we start to see a lot of that activation energy go down. I believe that, the Canadian GME system is making climate and health and planetary health a required core competency by 2025. And so you can even look to that kind of medical system as a really good example of now suddenly there's an uptick in folks who are becoming directors of planetary health at institutions in Canada. And so I point to that a lot in my talks now to say, hopefully it won't be long before we're there. And this is a core competency for all US trained physicians and, other health professionals and clinicians. And so it's really exciting to see how continuing to do this, have opportunity to engage in community and build momentum can make a difference for those places that might be a little resistant to initial efforts.
So with that, we're going to stop. I'm going to hand it back to Sapna to close and to talk about some housekeeping for the next few sessions. Before I hand it to Sapna, I just want to also quickly say we have acknowledged our wonderful student partners in this process and the NorCal Symposium. And I also want to acknowledge some of our key faculty collaborators and partners who really have helped move this symposium forward and lead it through. From Stanford, UCSF, Ann Davis, including Lisa Patel, Katie Brooks, Barb Ernie, Maria Zlotnik, Angela Haksu, and William Pevick. So thank you. It's been a joy working with you on this. And thank you, Carly and Harleen, for your time today. Deeply impressed with all the work you've accomplished. And thank you for being with us. And Sapna.
I'm going to pile on the thank yous. Thank you, Drs. Mara and Hampshire, for sharing your stories and experiences about climate action and student advocacy and leadership in medical education. And of course, thank you, Ariane, for moderating our first session. So the first session has ended, but we encourage you all to stay on for the second webinar of our 4th annual NorCal Symposium entitled How to Include Equity in Climate and Health Education and Garner Institutional Support. That will be followed by 3 other sessions, including a keynote from the founder and executive director, Julia Olson, of the nonprofit Our Children's Trust, and more sessions about health education. Now we have a short break before our next session, and so we'll see you after the break. Thank you, everyone.